So someone was having a lot of discomfort in this SI lower back area where this pain was starting to come down through their butt area. So we use this weight as good feedback for them so they can try to feel good pressure through their pelvic area. And from here what we did was we figured out how to draw or expand our belly, feeling like we're lifting this kettlebell up. And they had to figure out how to hold that position and breathe behind it. So keeping a lot of pressure through that lower chamber and working towards 10 to 30-second holds. After that, we did the reverse, trying to draw that kettlebell inward. Same thing, working towards 10, 30-second holds, figuring out how to breathe behind there. And we did that for maybe 2 or 3 sets. That was it. After that, they just felt a lot of relief on their SI. They were able to pick up their leg again, felt much better. And that was helpful for them. So I hope it helps you. Of course, if you have any questions, let me know.